If you're on Medicare, next year in 2025, there's a high probability that your prescription drug costs will be capped at a certain amount. And this seems like great news. However, as is the case with any legislation, there's always fallout from some of these changes, and that's what I want to talk about in today's video. If you're new to my channel, my name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people understand how the Medicare program works, as well as connect them with the coverage that fits their needs. There are a lot of changes that are going to be happening around the Medicare world in 2025, and you're going to want to make sure that you're staying tuned and you're updated with the latest information. So make sure you subscribe to my channel, click the bell notification so you know when I upload. Okay, so you may have heard that next year, if you're on Medicare, your prescription drug costs will be capped for the year. And although this seems like good news, obviously there's always going to be some sort of fallout from this legislation. And one of the things I want to talk today about in this video is the pharmacies that you go to get your prescription drugs, how this legislation is going to affect them, because it will affect local pharmacists, especially independent local pharmacies. I have clients and I have people I talk to all the time on Medicare who know their pharmacists personally, and they will call me and they'll say, I was speaking to my pharmacist about some of these changes in the Medicare world, and they were a great resource for me. I would encourage you, if you don't know already who your pharmacist is, to make a connection with them, because they will also be a great resource for you. But one of the fallouts from this legislation is that pharmacists now have to decide how they are going to recoup the potential loss that they would of income that they're going to receive because of these lower out-of-pocket expenses for you. And so I'm going to share my screen here and highlight this article, and I'll put a link to it in the description of the video if you want to read it for yourself. But it's entitled, Biden's Plan to Save Money on Medicare Drugs Risks Leaving Shelves Empty, pharmacists say. So let's dive into this article and look at it in a little bit more detail. And I'll blow it up so hopefully you can read it there on your screen. It says, months into a new Biden administration policy intended to lower drug costs for Medicare patients, independent pharmacists say they're struggling to afford to keep prescription drugs in stock. It would not matter if the governor himself walked in and said, I need to get this prescription filled, said Clint Hopkins, a pharmacist and co-owner of Pucci's Pharmacy in Sacramento, California. If I'm losing money on it, it's a no. A regulation that took effect in January changes prescription prices for Medicare beneficiaries. For years, prices include pharmacy performance incentives, possible rebates, and other adjustments made after the prescription was filled. Now the adjustments are made first at the pharmacy counter, reducing the overall cost for patients and the government. But the new system means less money for pharmacies that acquire and stock medications, pharmacists say. So here's the thing. You may have a strong opinion about this topic one way or the other as it relates to Medicare dollars. But the bottom line of this article is that these legislation changes will ultimately affect pharmacists, which could potentially affect your access as a Medicare beneficiary to these prescription drugs. Again, this is something that you're going to want to be aware of. Pharmacies are already struggling with staff shortages, drug shortages, fallout from opioid lawsuits, and rising operating costs. While independent pharmacies are most vulnerable, some big chain pharmacies are also feeling a cash crunch, particularly those whose parent firms don't own a pharmacy benefit manager. Companies that negotiate drug prices between insurers, drug manufacturers, and pharmacies. A top official at the CMS, which is the Centers for Medicare and Medicaid Services, said it's a matter for pharmacies, Medicare insurance plans, and PBMs to resolve. PBM being Pharmacy Benefit Manager. Okay, so let's just recap what's happening here. So the government puts into place, they say we're going to limit prescription drug costs for people who are on Medicare. That sounds great, good. Now it's up to the insurance companies, many of which have Medicare Advantage plans or Part D Medicare plans. They negotiate, and they will be negotiating even more now with the government in order to facilitate these changes. But on the other end, they also have to negotiate with pharmacists and pharmacies to say, we would like to use you as a pharmacy because that's where our beneficiaries go to get their prescriptions, right? And so we would like you to accept our Medicare health plan. Well, guess what? That is a negotiation that happens between an insurance company and the pharmacy. But CMS, the Centers for Medicare and Medicaid Services, they don't have any say in that negotiation. It's between the insurance company that wants to provide beneficiaries the Medicare health plan and the pharmacy to come to terms with how that deal actually happens. And so if you read this, it goes on and says, we cannot interfere in the negotiations that occur right here on your screen between the plans and pharmacy benefit managers. We cannot tell a plan how much to pay a pharmacy or a PBM. Nevertheless, CMS has reminded insurers and PBMs in several letters that they are required to provide the drugs and other benefits promised to beneficiaries. So what does this mean? So what's happening is cutting back on brand names. Several independent pharmacists told KFF Health News they'll soon cut back on the number of medications that they keep on shelves, particularly brand name drugs. Some, listen to this, have even decided to stop accepting certain Medicare drug plans, they said. So this is something, again, that you're going to want to be aware of. So if you are taking any sort of prescription drugs and you have a Medicare health plan, whether it's an Advantage plan or a Part D plan, this is potentially going to impact you. This is something you're going to want to be aware of. And truthfully, you can understand, at least I can, the position that pharmacies find themselves, right? They can't give away, and when I say give away, I mean they can't not make money on the the prescriptions that they're offering. They need to make money too in order to cover all of their operating costs. So this is highlighting to you, again, the fallout that can happen when you have legislation changes that happen in Washington, D.C., particularly around the Medicare world, the Medicare space. So let's jump in and keep on reading. As he campaigns for re-election, President Joe Biden has touted his administration's move to make prescription drugs more affordable for Medicare patients, hoping to appeal to voters troubled by rising health care costs. His achievements include a law, and this is what it's called, I've talked about this in other videos, the Inflation Reduction Act that caps the price of insulin at $35 a month for Medicare patients, caps Medicare patient drug spending at $2,000 a year beginning next year, and allows the program to bargain down drug prices with manufacturers. So again, at face value, this sounds really good, but we always need to ask ourselves the question, what is the fallout for this? And before, it's funny that some people in my comments accuse me of being political. Before you try to pinpoint me and label me in a political corner and paint me into a political corner, my goal is to help you really truly understand what this means for your coverage. Okay? That's why I make these videos. I don't have to make videos like this. I don't have to have a YouTube channel. I feel inspired and excited and happy to be able to help educate you as a Medicare beneficiary to really understand what's really taking place beyond what the news headlines tell you. Whatever news network you watch, I really want to use my channel to educate people. Whoops, that was the little screen. So let's keep reading. More than 51 million people have Medicare drug coverage. CMS officials estimated the new rule reducing pharmacy costs would save beneficiaries $26.5 billion from 2024 through 2032. Medicare patients' prescriptions can account for at least 40% of pharmacy business, according to a February survey by the National Community Pharmacists Association. Independent pharmacists say the new rule is causing them financial trouble and hardship for some Medicare patients. In other words, it's not just that the pharmacies are suffering, but actually the Medicare beneficiaries. He said Hopkins in Sacramento said that some of his new customers used to rely on local grocery pharmacies, but came to his store after they could no longer get their medications there. The crux of the problem, here it is cash flow, the pharmacists say. Under the old system, pharmacies and PBMs reconciled rebates and other behind-the-scenes transactions a few times a year, resulting in pharmacies refunding any overpayments. Now, PBM clawbacks happen immediately with every filled prescription, reducing pharmacies' cash on hand. That has made it particularly difficult, pharmacists say, to stock brand name drugs that can cost hundreds or thousands of dollars a month for a month's supply. So it says, some patients have been forced to choose between their pharmacy and their drug plan. And that's because some pharmacies just stop taking certain Medicare health plans. That happens. It says, some patients have been forced to choose between the pharmacy and their drug plan. Kavanaugh Pharmacy in Little Rock, Arkansas no longer accepts Cigna and WellCare Medicare drug plans, said co-owner and pharmacist Scott Pace. He said the pharmacy made the change because the companies use Express Scripts, a PBM that has cut its reimbursements to pharmacies. We had a lot of WellCare patients in 2023 that either had to switch plans to remain with us or they had to find a new provider, Pace said, meaning new pharmacy. Pace said one patient's drug plan recently reimbursed him for a fentanyl patch $40 less than his cost to actually acquire the drug. Because we've had a long-standing relationship with this particular patient and they are dying, we took a $40 loss to take care of the patient. So imagine that this type of stuff is happening in these local independent pharmacies. These are just a couple examples. But on a national level, think about how big this potentially is. Express Scripts, which is owned by the Cigna Group, managed 23% of prescription claims last year, second to CVS Health, which had 34% of the market. In North Carolina, pharmacist Brent Talley said he recently lost $31 filling a prescription for a month's supply of a weight control and diabetes drug. To try to cushion such losses, Talley's Hayes Barton Pharmacy sells CBD products and specialty items like reading glasses, bath products, and books about local history. But that's not going to come close to making up the loss generated by the prescription sale. So I won't go on because this pretty much covers what I wanted to cover in today's video. Again, the point of today's video is just to highlight to you that when you have these legislation changes that happen, and in this case we're talking about Medicare, that there is fallout from these legislation changes that many times the people who help put these into place they're not even aware that this is going to happen, because they don't think about the long-term effect of this type of legislation. So I would love to hear from you if you've ever spoken to your personal pharmacist, or maybe this will motivate you to talk to them, and then you can come back here and leave a comment on my video, because I would love to hear your experience. And just by way of reminder, some of the biggest changes in Medicare will happen going into year 2025. So again, this is something you're going to want to stay up to speed with. You're going to want to know what's happening, so make sure that you subscribe to the channel, that you click the bell notification so you know when I upload. And if you have questions about Medicare, feel free to leave them in the comments below. Thanks for watching. I appreciate all of you very much. Have a great day.